Imagine two children, Katie in England and Caleb in the United States, both struggling to communicate with their peers due to speech delays.
Katie's parents reach out to their local general practitioner, and within weeks, Katie is placed on a waiting list for speech therapy through the National Health Service in London.
Meanwhile, Caleb's parents begin a different journey in the US, navigating insurance policies, calculating out of pocket costs, and scrambling to find a private therapist who accepts their coverage.
While both families want the same outcome, their experiences are vastly different. What if the care your child received wasn't determined by their needs, but by where they were born? I'm Riley.
And I'm Shayna. And today, we'll compare the role of the NHS in England with the United States open market healthcare system to understand how each impacts the provision and management of speech-language pathology services. Let's take a step back to understand how these two systems came to be. The National Health Service, or the NHS, in England was born in 1948, at a time when the country was rebuilding after World War II. Its creation was driven by the idea that healthcare is a basic right, not a privilege. Aneurin Bevan, the health minister behind the NHS, believed that care should be free at the point of use and funded through taxation. In contrast, the U.S. healthcare system evolved with a focus on personal responsibility and free market principles. Employer-sponsored insurance became the norm during World War II, as companies used benefits to attract workers amid wage freezes. Over time, private insurance grew, creating a system where healthcare became a privilege, not a right. These founding values, equity and collectivism in the NHS versus individualism and market-driven solutions in the US, continue to influence how care, including speech-language pathology services, is provided today. When it comes to funding, the NHS and the U.S. healthcare system operate on completely different models, and this directly impacts access to speech-language pathology services. In the NHS, funding comes from general taxation, which means services like speech therapy are free at the point of use for patients. While this ensures universal access, it can also lead to significant wait times due to limited resources and high demand. It can also impact the amount of therapy sessions each client is allotted. In the US, however, healthcare funding is broken up, relying heavily on private insurance, employer-sponsored plans, and government programs like Medicaid. This creates a system where access to SLP services often depends on your ability to pay or your insurance coverage. For example, uninsured families or those with high deductible plans may struggle to afford private therapy, while families covered by Medicaid may face a shortage of providers who accept it. These differences highlight a fundamental trade-off. The NHS prioritizes equitable access, even if it means delay, while the US emphasizes choice and immediacy, but only for those who can afford it. As you can already tell, speech-language therapy services look quite different in the NHS compared to the US because of how each healthcare system is structured. In the NHS, SLP services are primarily delivered through public clinics, schools, and hospitals, with the government overseeing and funding from the NHS. While this ensures that everyone has access, services are often limited by high demand and strict eligibility criteria. For example, children may only qualify for therapy if their speech delays significantly impact education or social interaction. On the other hand, the U.S. offers a mix of public and private options. School-based SLP services are free and federally mandated for students with qualifying disabilities. But outside of schools, families often turn to private practices or teletherapy, but once again, only if they can afford it. This dual system gives U.S. families more flexibility and choice, but it can leave low-income or uninsured individuals with fewer options. We've dabbled in it some, but let's talk about the client experience. The patient's journey for speech-language therapy services can vary dramatically between the NHS and the U.S. healthcare system, with each offering its own set of challenges. In the NHS, patients typically need a referral from a general practitioner to access SLT services. Once referred, they often face long wait times, sometimes stretching several months. However, the care itself is free, making it accessible to everyone regardless of income. In contrast, the U.S. system allows patients to bypass referrals in many cases, giving them faster access to SLP services. But once again, if they can afford it. Cost can be a significant barrier for U.S. families, especially those without insurance or with high deductibles, as out-of-pocket expenses for therapy sessions can add up quickly. Where the NHS places a priority on equity and affordability, the US system prioritizes convenience and choice, often at the expense of accessibility for lower income families. We're going to dive deeper into the role of insurance. Health insurance plays a huge role in determining access to speech language pathology services in the US. In the US, whether someone can afford therapy often depends on their insurance coverage. Private insurance plans may cover SLP services, but coverage varies widely and can include restrictions like session limits or requirements for a medical diagnosis. Medicaid offers a safety net for low income families, but finding SLP providers who accept it can be challenging due to lower reimbursement rates. Families without adequate insurance may face significant out of pocket costs, which can deter them from seeking care altogether. In comparison, the NHS model eliminates financial barriers at the point of service. Since the NHS is funded through taxation, SLP services are free to all who qualify. However, the trade off is often long wait times as resources are spread across a larger population. While the US system prioritizes choice and immediacy for those who can afford it, the NHS focuses on ensuring universal access, even if that means delays.
The employment conditions, training opportunities, and professional expectations for SLTs in the NHS and SLPs in the US healthcare system vary quite a bit. After completing a 3-year bachelor's or comparable master's degree in speech and language therapy and registering with the Health and Care Professions Council, or the HCPC, individuals can work within the NHS as an SLT. Within the NHS, SLTs are assigned a band ranking, and that standardizes their salary and governs their role as an SLT. While NHS SLTs enjoy many benefits, they often face heavy workloads due to caseloads and resource limitations, though interdisciplinary teams support helps manage this. SLTs in the UK are expected to engage in ongoing professional development, with opportunities for additional training through the HCPC, or, if they choose to become a member, the Royal College of Speech and Language Therapists, or the RCSLT, which offers free development courses. In the United States, becoming an SLP typically requires a 4-year bachelor's degree in communication disorders, followed by a master's degree in speech-language pathology. Unlike the NHS, there is no ranking system present within the US healthcare system, so an SLP's salary and role, as well as caseload, can vary depending on the SLP's work setting. SLPs are required by ASHA to pursue continuing education to maintain their license, though these opportunities are not always free. As we know, the NHS provides universal coverage for its citizens, with speech-language therapy being an included service. However, disparities still exist within its system. Geographic location is arguably the largest contributing factor to these disparities, as individuals in low-income or rural areas often face longer wait times and limited access to specialized care. Although speech therapy is available to everyone, these regional disparities can often complicate the delivery of these services. In the United States, disparities are exacerbated by the insurance-based system, where those with private insurance options or higher incomes have more freedom to choose their SLP and other service providers, unlike the NHS, where a general practitioner typically determines the provider. Both systems are reflective of broader societal inequalities, such as economic inequality and regional disparities, leading to access to speech therapy services being unequal and reinforcing social inequality. The patient outcomes and efficiency of delivery services for speech therapy vary between the two systems, as their approach to care greatly differs across the two systems. As we've touched on, the NHS universal healthcare approach aims to ensure equitable services for individuals, but constraints on resources, as well as heavy caseloads and the regional disparities that we touched on earlier, often lead to long wait times and less specialized treatment, which has the potential to impact the outcome of a patient. That being said, we learned at the Michael Palin Center that SLTs in the NHS, and just generally in the UK, tend to heavily emphasize preventative care and early intervention, which can lead to positive long-term results. As mentioned earlier, the outcomes and efficiency of delivering services within the US often vary significantly, with those who are privately insured tending to have quicker access, more personalized care, and advanced resources, whereas those with insurances such as Medicaid, or those with no insurance, face significant barriers in receiving services. We would like to briefly compare stuttering services across the two systems to provide further insight into the differences in delivery of services. The Palin Center's approach to stammering therapy was particularly noteworthy, as it focused on helping individuals accept and feel comfortable with their stammer, while also empowering them to educate others, a method that has earned the center a reputation as one of the best stuttering clinics internationally. In contrast, stuttering therapy in the US is more prone to helping individuals reduce or potentially eliminate their stutter, emphasizing improvements in fluency. We have not looked into the exact research on which of these approaches is ultimately more effective for the client, but it is interesting to think about the different outcomes these approaches can have on individuals. This difference in approaches towards stuttering therapy highlights the broader cultural attitudes towards healthcare and speech difficulties, which significantly influences how speech therapy services are utilized in each system. As we learned throughout our time in London, the NHS is deeply respected and often viewed almost like a sacred institution. This respect reinforces the NHS's goal of universal coverage, as it encourages individuals to seek services without financial barriers, helping them to reduce stress and promote the prioritization of healthcare. As we saw at the Michael Palin Center, NHS SLTs are actively working to reduce the stigma surrounding speech difficulties, which further promotes the utilization of these therapy services. In contrast, within the US healthcare system, individuals may not feel as inclined to seek out services due to the nature of its insurance based system. Treatment can often be more expensive dependent upon the client's needs, so they may refrain from seeking out treatment due to financial stress dependent upon insurance. Advocacy is also a huge aspect of the profession of speech language pathology in the US, so SLPs are constantly advocating for more accessible care to for their clients, as well as enhancements of their healthcare system to better it for clients and SLPs alike. Both systems could benefit from adopting aspects of the other. The NHS's universal coverage model has diligently been working towards ensuring equitable, accessible care, and the US could achieve similar equity by expanding insurance coverage of services. The US could also benefit from implementing the more early intervention, preventative approach to speech therapy that the NHS adopts, as this would help to ensure timely and early access to services. On the other hand, the NHS could streamline service delivery by offering more choice in provider selection, reducing reliance on GP referrals, and addressing long wait times, such as the US. By learning from each other's strengths, both systems could improve the provision and management of their SLP services.
Here are the sources we used, and thank you for listening to our TED lesson.